I'm Rachel Canute, the practice manager from Boughton Health Centre in Chester. We went live with online medical records access in February 2015. I've always felt passionate about empowering patients on having access to their own medical records. I did lots of planning and research. I then started to discuss that in the practice with the clinicians and admin team. One of the first steps that I took with the project was to engage with other practices that had already been utilising this for a number of years. I was lucky that they shared protocols, best practice and top tips with me. This made it feel more manageable and it made it feel as though it was more achievable. I researched using all the documents available, such as the NHS England guidance and the RCGP guidance. They helped to establish a clear view on what was needed from the practice perspective. The next step of the project was to look at roles and responsibilities of who would manage some aspects of the project, and I felt it was important that we had a GPIT lead, and that's Dr. Ed Henry.
As the practice IT lead, I've been liaising and overseeing the documentation that the management and administrative team have put together to enable patients to both apply and gain access to their medical records. I helped edit and draft the documentation from a clinical perspective to pick up on things that the admin staff may not pick up on because of their non-medical background.
We've devised a really useful flowchart which details each process in each stage. It also explains who's responsible for each stage from start to finish, which is really useful for all members of the team to use.
I engaged with the patient participation group quite early on in the project because I felt it was important to have their involvement with this. In the run-up to the project going live, we did deliver lots of staff training sessions. These were delivered with the reception and admin team on protected learner time and coffee sessions. And we also did sessions for the clinical team and demoed how it would look like from a patient's perspective.
To phone up for the result.
In the run-up to going live, I was responsible for the reception training. We introduced new dialogue to the reception team and the clinical team. We can have a look into that as well.
We launched full online access to medical records in February 2015. Since this date, we do have regular team member update sessions, and we also have sessions with clinicians to promote the service and also raise awareness to continue promoting the service to patients.
We had an incredible response right from the start. Patients were really interested in getting access to their medical records and they were quite excited about it. We had quite a few requests in within the first few weeks.
Record access, please, I believe.
Therefore, the turnaround within the first few weeks was going from between 2 and 4 weeks before we could get each patient actually active. However, now with different sort of systems in place and the flowchart in place, we're now turning them around within 2 weeks.
Brilliant. Okay. Do you want me to fill this in now?
Now that the system is up and running, it seems to run very smoothly and it has very little impact on actual GP work. I might spend 5 or 10 minutes maximum on average on a day dealing with finalising patient online access requests.
I'm really proud with the way the team has embraced the project. I do feel now that the benefit to empower the patients and the decreased activity on the telephone lines is helpful to the practice also.